What is the specific mechanism of action of local anesthetics in preventing the conduction of nerve impulses? Options are option A, antagonism of NMDA receptors, option B, blockade of voltage gated sodium channels, option C, activation of GABA receptors, option D, inhibition of potassium efflux. The correct answer is option B, blockade of voltage gated sodium channels. Local anesthetics, they bind to internal subunit of voltage gated sodium channels, preventing the influx of sodium necessary for action potential generation. So that's the correct answer. Next question. Question number 1. A 45-year-old male with a history of well-controlled hypertension and a BMI of 28 kg per meter square is scheduled for an elective inguinal hernia repair. According to the ASA, that is American Society of Anesthesiologists, physical status classification, how should this patient be categorized? Options are option A, ASA1, option B, ASA4, option C, ASA2, option D, ASA3. The correct answer is ASA2. ASA2, it includes patients with mild systemic disease without substantive functional limitations such as well-controlled hypertension, mild obesity or controlled diabetes. Next question. Question number 2. Which of the following inhalational anesthetics is characterized by the lowest blood gas partition coefficient, contributing to its rapid induction and emergency properties? The options are option A, sevoflurane, option B, isoflurane, option C, halothane, option D, desflurane. The correct answer is option D, desflurane. Desflurane has the lowest blood gas partition coefficient among these choices, allowing for extremely rapid titration of depth. Next question. Question number 3. During a rapid sequence induction RSI, a patient develops masseter muscle rigidity after administration of succinylcholine. This clinical sign is most significantly associated with which life-threatening condition? Options are option A, neuroleptic malignant syndrome, option B, hyperkalemic periodic paralysis, option C, pseudocholinesterase deficiency, option D, malignant hyperthermia. Correct answer is malignant hyperthermia. Masseter spasm is a highly specific early warning sign of malignant hyperthermia. It is triggered by volatile agents or succinylcholine. So next question. Question number 4. A patient with end-stage renal disease ESRD requires a surgery. Which non-depolarizing muscle relaxant is preferred due to its metabolism via Hoffman elimination and ester hydrolysis? This is independent of renal or hepatic function. Options are option A, cis-atracurium, option B, vecuronium, option C, pancuronium, option D, rocuronium. The correct answer is option A, cis-atracurium. It undergoes Hoffman elimination. What is that? It is independent of renal or hepatic function, organ independent breakdown, making it the drug of choice for patients with multi-organ failure. Next question. Question number 5. The second gas effect. It occurs when a large volume of primary gas like nitrous oxide is absorbed from the alveoli, concentrating the co-administered volatile agent. Which law of physics primarily explains this phenomena? Options are option A, Fick's law of diffusion, option B, Gay-Lussac's law, option C, Henry's law, option D, Boyle's law. The answer is Fick's law of diffusion. Fick's law, it describes the rate of diffusion across a membrane. The rapid uptake of nitrous oxide increases the concentration of remaining gas in the alveoli. Question number 6. Question number 6. A 28-year-old parturient develops profound hypotension and bradycardia immediately following the administration of spinal anesthetic. What is the most likely physiological mechanism? So in this case, there is profound hypotension and bradycardia. Options are option A, aortocaval compression, option B, high sympathetic block, that is Basold-Jarich reflex, option C, systemic toxicity of bupivacaine, option D, anaphylaxis to the local anesthetic. So in this case, the correct answer is option B, high sympathetic block. That is spinal anesthesia, it causes sympathetic blockade, a high block involving T1 to T4, that is cardio accelerator fibers. It leads to bradycardia and venous pooling, triggering the Basold-Jarich reflex. So next question number 7, which intravenous induction agent is the most appropriate choice for a patient with severe cardiovascular instability or shock owing to its minimal effect on cardiac output and systemic vascular resistance? Options are option A ketamine, option B propofol, option C thiopentone, option D etomidate. The correct answer is etomidate. Etomidate is known for its hemodynamic stability. However, it can cause transient adrenal suppression. Next question number 8. In the Cormack-Lehane classification used during direct laryngoscopy, a grade 3 view is defined as seeing. Option A, full view of the glottis. Option B, only the epiglottis visible, no glottic structures. Option C, no structures visible including the epiglottis. Option D, partial view of the glottis or arytenoids. The correct answer is B, only the epiglottis is visible, no glottic structures. Grade 3 involves seeing only the epiglottis, while grade 4 is when neither the epiglottis nor the glottis are visible. Next question number 9. Sugam Maddox is a novel reversal agent that encapsulates which specific type of neuromuscular blocking drugs to reverse their action? Sugam Maddox. Option A, all the non-depolarizing agents. Option B, benzyl isoquinolineiums. Example is atracurium. Option C, depolarizers. Example, succinylcholine. Option D, aminosteroids. Example, rocuronium. The answer is option D, aminosteroids. Example, rocuronium. Sugam Maddox is a modified gamma cyclodextrin that specifically encapsulates administered relaxants like rocuronium and vacuronium. Next question number 10. What is the specific mechanism of action of local anesthetic in preventing the conduction of nerve impulses? That we have already seen. This is blockade of voltage gated sodium channels. Thank you.